Hi, you guys, it's Miss Alicia. Okay, this is a video I'm preparing you guys for exam one. Just understand that amongst your busy schedules, you're going to have to take the time to buckle down to study for this exam, right? The only way you're going to be extremely successful is by taking the time to study. I'm going to post also under this announcement will be like a study guide via PowerPoint. It will also be a paper where you can go through and check off the things on there that you have gone through as far as studying for the exam. And that way you can go by like a check off basis, like I already studied ageism, I already studied calculations, and then that way you can kind of go through the check off list to make sure that you have studied everything. By far, the biggest change for older adults, the biggest change that they are going to be concerned with is their independence. Any question asking you about the biggest concern for the older adult in their changes of aging, it's going to be their independence. They are concerned about their independence, and so is their family. If you have an older adult come into the hospital and they tell you there are things that they don't want, specifically like I don't want to be intubated or I don't want CPR, what the provider is going to need to carry out her wishes is going to be called a physician's order of life-sustaining treatment. Nutrition is a big deal for older adults. So if you are interviewing a patient or an older adult, they're coming in for their checkup and you're asking them questions and they say something along the lines of my clothes are no longer fitting, that is something for you as the nurse to follow up on because nutrition is a really big deal. It's important as nurses to always educate your patients. So remember that when you are teaching your patient about good health and good nutrition, that we are reinforcing for them to read the back of the nutritional labels of the food they are buying. Age discrimination, be well versed in age discrimination. Know that age discrimination takes emotions and goes into an action, right? So it's you not doing something for an older adult because of their age, right? An action in itself. So there'll be a lot of curveballs as far as things that they're saying when the provider gets to not doing something, or when they say, I'm not going to do something, that is an action. And that is more about age discrimination. Elder abuse is a big deal, and you're going to have to be able to know the signs and symptoms of it, right? So if a patient comes in and they say something like, I'm alone all the time, that's a sign of elder abuse. If a patient comes in and they have a lot of bruises and stuff on them, that's a sign of elder abuse. If a patient comes in and the caregiver is speaking for the patient all the time, that's a sign of elder abuse. If they don't look tidy, if they smell bad, that is a sign of elder abuse. The primary reason for an older adult to reside in an assisted living is because they need assistance with their ADLs. They need assistance with their activities of daily living. If a client comes in the hospital and they tell you that they don't understand Medicare Part B, you tell them that it covers 80% of their care after their deductible. For stuff like PT, home health, and stuff like that, provider fees. So 80% of their provider fees after they pay their deductible is Medicare Part B. Potential abuse and neglect is a big deal with the geriatric population, and you will have to interview them. If the patient brings up anything about their family members taking their credit cards or taking their money, that is a sign of abuse. Making choices for your patients violates their rights. So if a patient can't speak, they still have a right to make their own choices when it comes to food or what they want to drink or what they want to do. So know that making choices for your patients is a violation of their rights. If you are speaking to a family member and they express frustration with caring for their loved one, it is appropriate for the nurse to suggest respite care. For your recommended health screenings, we are recommending an initial bone screening density exam at age 65. If you're giving out medication and your patient asks what it is for, it is best to explain what it is as simple as possible. So if you're giving out medication for an infection, you say this is an antibiotic to treat your infection. The most reliable method to identify your patient is the patient's identification bracelet. Medications that are enteric-coated, that are capsules, right, and that are sublingual should not be crushed. Medications that can be crushed are tablets. Polypharmacy is the prescription, administration, or use of more medications than clinically necessary. If you have to call the provider about a change in status for your patient, you want to use SBAR, situation. What's going on with the situation? Background, how were they in the morning compared to how they are now? Assessment, what you noticed, right? And what you recommend, right? So for instance, Dr. Smith, the patient appears to be confused. This morning when I came in, he was a GCS of 15. He was okay. He was normal. And when I went in this afternoon, I noticed that he kind of had slurred speech and was confused. I recommend that you can at least come down and see the patient. Maybe he needs like a scan of his head or something like that. A good predictor that a newly diagnosed hypertensive patient will adhere to their recommendations of a low sodium diet is if the patient shows that they want to avoid complications with hypertension. Age-related sensory changes can increase the older adults' risk for accidents at home. So if a patient is having issues with their sight, that will increase the risk for falls. When you are reviewing your medications with your patients, you're discharging them home or you're the home health nurse taking care of them, make sure that you read the bottle with them and that you educate them on interactions, food interactions. There are medications that interact specifically with different types of foods, grapefruit juice and stuff like that. Make sure that you educate them on that so they are aware of what not to eat to avoid an interaction. When instructing your patient to take their blood pressure before they take their blood pressure medication, make sure that you tell them to check a radial pulse, either their left or their right, but they should be checking their pulse and their radial. Know the difference between gerontophobia, rapport, dysphagia, aphasia, and cataracts. If you have a patient who is aphasic, they are probably frustrated because they can't communicate well. The best way for them to communicate would be a communication board. If you are about to collect data from a patient who has hearing aids, you want to be ready to facilitate visual cues when communicating with that patient. What is the screening test for colon cancer? Colonoscopy. You got it. Vision testing is included in your yearly physical examination of your 65 and older patient. Know your vaccinations for your 65 and older patient very well. They should be getting the flu vaccine yearly. They should get their pneumococcal conjugate, right, PCV 13. And then yearly after that, they should be getting pneumococcal polysaccharide, the PSV 13. And they should be getting a tetanus booster every 10 years. So know your vaccinations for your geriatric patients well. When teaching your geriatric patient about the shingles vaccine, if they make a comment that their immune system is healthy and they don't need the vaccine because they have a healthy immune system, you need to go back and re-educate your patient. Walking 30 minutes a day, 3 to 5 times a week, supports and promotes healthcare maintenance for the older adult. If you are speaking to your patient about medication education and they say something like, oh, I always keep extra medication just in case, I keep leftover antibiotics, you need to re-educate your patient. If you're the nurse and you're speaking to a client about their dentures and they say something like, oh, now I don't have to worry about choking on my food, you need to re-educate your patient. It is important for you, the nurse, to understand that when it comes to money and the older adult, they rely on Social Security as a major source of income. The older adult has difficulty changing their health behavior because these beliefs were set into place early in life. If a volunteer says that he stays with an older adult while their primary caregiver goes to church and hangs out with their friends, that is called what type of care? Respite care. Be ready to prioritize care, right? So if you get a patient and you get them in the room and they say, I have the worst headache of my life, that's an emergency, right? It could be a stroke. Or if they say something like, I fainted today when I was cooking breakfast, that's a big deal, right? Or if they say something like, I've been vomiting since yesterday morning, that's huge. These are all reasons to immediately call the physician. But if they say something like, oh, I haven't pooped in 3 days, it indicates that they're having constipation, but it's not like something that's extremely worrisome. If you are collecting data from a patient who is visually impaired, the best way for you as the nurse to facilitate communication is to monitor and to visualize and to pay attention to their nonverbal communication. If you are communicating with an older adult who is not proficient in English, you should make sure that you find out what language they speak. You should get an official translator. You should allow extra time for them to respond, and you should listen to the emotional tone of the patient's responses. If you are educating a patient, let's say about diabetes, and you notice that they're looking around the room, wiggling around in the chair and not paying attention, you want to stop and ask the patient, what do they think about the information? This will help them become more engaged. If you are about to collect data from a patient who has hearing aids, you want to be ready to facilitate visual cues when communicating with that patient. Always assess your vital signs. If the patient's blood pressure is low, like a systolic less than 90, you as the nurse should initiate fall precautions. The geriatric patient with cataracts, that puts them at increased risk for injury. Specifically, it puts them at increased risk for falls. If your geriatric patient makes a comment like, I don't eat much because I can barely taste or smell, that puts them at a potential safety risk, right? Think of like fires. If there's a fire in the home, they can't smell well, they may not notice it, or if their food is too hot. So not being able to smell or taste puts them at a potential safety risk. Walking 30 minutes a day, 3 to 5 times a week, supports and promotes healthcare maintenance for the older. Always assess your vital signs. If the patient's blood pressure is low, like a systolic less than 90, you as the nurse should initiate fall precautions. Just quickly, you guys, the key to success, right, is going to be preparation. So make sure that you adequately prepare yourselves, right? Every second of the day if you're at work, right? Make sure that you have the Quizlet that I uploaded for you guys to practice that. And when you're in your car, listen to the videos. And, when you get home, it's always good to have a partner to help you go through things. So the key to being successful on your first exam is preparation. I've given you all the tools. There are multiple review sessions this week. If you have any questions or concerns or need anything, you guys know to message me. This is Miss Alicia. You guys got it. Stay motivated. Stay positive.